So sometimes teams are difficult to get into if you're outside of the city. So hold tight. We'll start in a couple minutes. Okay, let's go ahead and get started. I want to respectful of time, and we have presentations that we're going to give. Again, welcome. This session is being recorded, and just for our purposes, and so that we can come back and review it, and also ensure that our community members are have access to it as well, the ones that weren't able to join us. But my name is Tony Newborn, pronouns she, her, hers. I serve as in dual roles with the city as the Chief Equity Officer as well as the HR Director for the City of St. Paul. My colleagues who are on the line, who have we have worked together to put this info session together. Noel Nix and Claire Verbatim are on the line as well, and they'll have an opportunity to introduce themselves. But we're here to have an info session about access to testing and to ensure that our community members, our community organizations have access to COVID-19 testing. And we have a few of our providers here on this call to provide some insight about what they're doing. And we want to make sure that our community members know about it, and there's opportunities for us to build partnerships with and to facilitate partnerships with the providers and our residents and our community as a whole. So just to give you a bit of background of how this group got started, COVID hit, and everyone was kind of scrambling and trying to figure out how are we going to provide the best services to our residents and to our city. And I know we have folks at the state and at the county who were thinking both countywide as well as citywide, and then we have our providers who are thinking the same. And the mayor was very, adamant and forthright about utilizing this role as a chief equity officer in the city to ensure that we are working with community on building and providing resources as it relates to COVID, and all resources, whether it's healthcare, whether it's providing resources to our businesses, to our families, to everyone. And so we lifted up. We already have within our work an racial equity framework citywide, mostly internal. But we wanted to stand up a work group that was inclusive of the community, that was related to COVID-19 and our response to COVID-19. And so we started a COVID-19 racial equity work group. And it started out with an internal group with the intent of inviting community to the table. And our first order of business was to host a series of what we call digital roundtables. And those roundtables took place in March and June. It seems like such a long time ago, but not just a few months ago. And we broke up the conversations the digital roundtables based off of community, and starting with the African American Black community here in St. Paul. We knew at the time and had been tracking the data around the inequities and disparities that our communities of colors were already experiencing pre-COVID, but were exacerbated when COVID hit. And the data was showing nationally that our Black community was the hardest hit at the time. Now, we've seen the reports and see how that's impacting all of our BIPOC communities as a whole, and largely as a collective. Our BIPOC persons of color, residents of color, have been heavy, disproportionately impacted by COVID. And so we held four different culturally specific roundtables: Black community, Latinx, Hispanic community, the American Indian and Native American Indigenous community, and then lastly the Asian American Pacific Islander community as well, and learned a lot of information and gathered a lot of information from community. And we broke up the conversations around public health and healthcare, legislative advocacy. How do we navigate with and work with our legislatures on providing resources? Community engagement, which is largely led by Noel Nix, who will introduce himself later on, and then economic justice, which is a big topic, which includes everything from the eviction moratorium and to rent and to jobs and mortgages and housing and support to our businesses. What came out of those roundtables was interest from the community to be involved in building out the work. And just want to remind you, make sure to put your phones on mute or your computers on mute. You're hearing some background noise. So we divided up the groups into public health, as I mentioned, economic justice, legislative advocacy, and community engagement. And not having a background in public health and sort of health equity work, Claire Verbatim and I decided to be the chair on the city side, the chair of that particular group. And we started to connect with Open Cities, MnCare, Ramsey County Public Health, and the state of Minnesota, their public health department, and forming a team and facilitating a team and a work plan and a strategy around three different areas: access to testing, which we know that varies depending on the resources that you have, and then there's the fear piece involved in getting tested. Access to PPE, hand sanitizers, and masks, and then developing culturally responsive communication and engagement strategy to ensure that we have communications going out that reflect the community, whether it's from a language standpoint or a person that represents the community talking about COVID-19 and how to protect yourself and social distancing, et cetera. This work group, public health work group, has been meeting for quite some time now, at least from mid summer, and have been putting together a mobile testing strategy. And the state and the county have put together kind of the large testing events. But what we're finding from community members and community organizations like yourself is that there's a need for smaller testing environments from trusted individuals, provided by trusted individuals and trusted community members, as well as in trusted spaces. So not going to the National Guard Armory, not going to these big venues, but instead going to our churches, going to our mosques, our masjids, our temples, and our consulates to host testing. And so this group is at a point now where we need your help as the community organizations, and we need and direction as to where do we go, how do we get there, how do we communicate out the resources, et cetera. So today, you'll hear from our healthcare providers who are on the line today, and they're going to provide information about the resources that they're providing. And then we've carved out about 30 minutes for that, but then we're going to leave time for question and answer, and time for you and as a representative of your respective organizations to ask questions or to provide insight into letting us know what should we be doing and where should we go. and what our approach should be, because not all approaches, as we know, is the best approach depending on the community. So with that, I'd like to move us into, I think I've covered most of the agenda items here, but would like to move to our presentations. And we have Vanessa Ng to start us off with our presentation. And Vanessa, if introduce yourself, and if you have a PowerPoint presentation, there's a way for you to share your screen. But if not, that's okay as well. We can just hear your voice, and I see that you're presenting on video as well. So welcome, and take it away.
Hi, thanks for getting this all together. I'm excited to be here. So I'm Dr. Vanessa Ng, and I'm one of the COVID project coordinators at Open Cities Health Center. So when it's not COVID time, I'm actually a psychologist, and I got kind of roped into some of the public health functions at our clinic, which has actually been quite fun, and I've enjoyed doing. I think we have like, what, about 5-10 minutes or so for each of us to present. Does that sound right?
Yes, that's correct.
Okay, great. I'll try to talk fast. I put together some slides, and let me see if I can try to, do I use the share tray? Is that what the button is to show the screen?
Yes, it should be a box that has an arrow pointing up.
Okay, I'll try to do that. And then I just go to my screen, right?
Yes.
Can you all see that? It says comprehensive COVID-19 response.
Not yet. Sometimes it
takes a second to load.
Yep. So once you hit on that box and that arrow, you go to the PowerPoint, and you do need to click on it in order to share. Sometimes it's a little tricky. And Vanessa, feel free to share it, send it to us, and we can share it on our end.
Oh, okay, let me see. Can you see it now?
Yes.
Yay, yay for technology. Okay, here's our lovely, this is actually not an actual patient. We're using one of our interns as the model here, but I'm so proud to present and talk about our COVID response. I think we've done a lovely job in really quickly, as many clinics have quickly gotten up and running this past spring, obviously without a lot of planning, because who knew that something like this is going to happen. I won't talk too much about the pandemic itself and the statistics. We've all been watching the news. Quite clearly, the United States has been hit really hard with coronavirus. And in Minnesota, we've been hit hard as well, maybe not as hard as maybe what our neighbors are experiencing in Wisconsin. But in recent weeks, we've seen an uptick in the positivity rates, and that's been rather alarming. But we're really also here to talk about not just COVID, but the racial inequities within healthcare. We've seen Blacks and Hispanics their positivity rates are incredibly high. I think in parts of the country they're 3 times as high, not just twice as high as whites might appear in that community. And that's certainly reflective in the data that we've been collecting over the last few months. So I think we got up and running in April, May was when we started to work on this project together. I'm really struck by some of the statistics when you look at our state. When you consider 80% of the Minnesota population is white and only 16% of the population are people of color, and you compare that to the percent of folks who have COVID, when you look at the middle bar, 51% of the people who are testing positive with COVID are people of color. That's pretty astounding. And I actually think that number that says 5% for Asian is really a misleading number, because we've found in St. Paul in particular, where our clinic is located, that there's been in the Hmong group and in the Karen community, there's been an incredibly high positive rate. And so that's not reflective maybe in the state total when we include other Asian populations. And the death percentage has mirrored more closely the population rate. So stopping the spread of COVID, we all know about distancing, we all know about washing our hands and wearing a face mask, but we as healthcare providers also have a part in identifying, isolating, and contact tracing in order to prevent the disease. Let's talk specifically about Open Cities Health Center. We've been around for a long time. We have been around for about 53 years, mostly focusing on patients of color and high risk, vulnerable populations. Our staff reflect the people in the community. We have a lot of bilingual staff. We have immigrant staff. We have a lot of bilingual people working in the building and relationships with bilingual interpreters who are volunteering within the community. We have a lot of experience with COVID testing. Actually, I need to update the slide. It says that we performed over 3,000 tests. Well, as of today, we're actually closer to 4,000 tests. We also have designated people in our building working on COVID. Actually, for much of the summer, we had close to 90 people working on our COVID effort. But now we're kind of lean and mean, and we have a specific team designated towards this. You'll see some fun pictures. I like our crew here. That's some of our nursing and lab team here. Most of our initiative with COVID testing has centered around drive-up testing, which has been, we have 2 clinic locations, one on Dunlap Street and one on Rice Street, which is in the north end neighborhood of St. Paul. And as I just said, as of today, I think we're at 3,950 tests administered. We were doing it every day, but now we're doing it several days a week with the hope to actually increase our testing once again, especially in response to the higher positivity rate lately. We can test about 100 people a day. I think at the top end, we actually have done 115. We have multiple interdisciplinary health workers working on this, along with Ramsey County medical volunteers. The people we test are greatly reflective of our Open Cities population, which is 40% Black, 18% Asian, 11% Hispanic, about 25% white, and 6% other. I think actually the slide doesn't reflect, 6% might be actually larger because when we go testing in the community, many people decide to decline to identify their race or ethnicity out of concern about what we do with that demographic information, and we want to respect what the patient wants as far as privacy is concerned. So when we first started testing in late April, early May, we were having some high positivity rates. And that's when there were so few places that were even providing daily ongoing comprehensive testing. I think we were reaching at about, at 1 week, our high was 28%, which is really astounding. And that's, I won't point out the specific community, but there was one Asian community in particular where there was an outbreak and we were identified as a site that could help respond. There was a processing plant that tapped us, and we kind of ran just many people through in order to help them with that. In the last few months, we're averaging about 11% positivity rate, which is still higher than what the state is really looking for when they talk about severe or alarming rates, which is, I think, 5%. And we've served over 20 languages, and that includes even sign language as we're doing COVID testing. Here's some pictures of our exterior at our Dunlap location, where we've gone through several iterations of what the exterior should look like. A smaller tent to this. This is a professional tent that we have set up, which we're going to probably move to either a container or an RV unit as the weather turns to winter. Here's the interior with some of our testing staff. We worked in partnership with the county, Ramsey County, and St. Paul agencies, as well as community and cultural organizations, North End Business Association, and specific community organizations. our job is to identify patients in high-risk, underserved communities to reduce outbreaks and to service outbreaks. We also want to bring a lot of education and outreach services using a mobile unit. While we've been doing a lot of drive-up testing, our intent is to be nimble and responsive to community needs, community breakouts. In fact, I'm really proud that today our crew, I had to leave early, but literally our COVID crew was asked to respond to an event at one of it was a housing residence, which I won't identify here. They identified a need for some COVID testing within Ramsey County, and the request was made 2 days ago, and they're at the event right now. Here's a picture of an example of something that we can do. We went to a tribute to John Lewis. We were watching a film on John Lewis and commemoration, and here's some of our lot where we did some COVID testing. This is actually hot off the presses a couple of hours ago. I'm on the far left there, and then Dr. Meyer, Victoria registration person, and Dr. Woods, who is our medical director / interim CEO. And that's literally the event that we were just at, that I just left, that they're just finishing in about 5 minutes. Why are we testing? Obviously to decrease the spread of COVID. We do it very safely. The test is very quick. People can register and get in and out within 5 minutes. We try to get results in within 2 to 5 days, and our outreach events are free. If anyone is interested in having a free event within their community, we have a new project lead who will be taking over from me, and her name is Dr. Mayer. And here's her contact information. I'm just showing this fun slide here. I'm not sure if you can see it at all. It's a little fuzzy, but basically we've been very hot on Twitter as far as some of the activity and services that we performed at Open Cities. We're really just proud to be involved in the community and to make it an easy service that someone can just walk up and get administered to them. So that's basically our services in a nutshell. We hope to be more extensive in the community by going to grocery stores and churches and some of the smaller and larger venues. And that's where things stand at Open Cities.
Sorry, everyone, taking myself off of mute. Vanessa, thank you so much for your presentation. I'm not sure, we're going to save questions for the end. I do want to point out that we have a representative from Lab, and as I talked about, access to PPE, and I believe that Adam is here on this call. And Adam, would you like to introduce yourself and talk about the PPE that your company is providing?
Yeah, hey guys. So my name is Adam Smith. I'm the business development manager here for the Lab. We're a pilot facility and brewery in St. Paul off 280 and 94. And so kind of obviously, as you heard just now, pilot facility and brewery doesn't exactly always make people think of COVID response plans. But the general gist is we built this place as sort of a proof of concept production facility for beverage entrepreneurs. So as part of that, we built out a full-scale quality lab to test things like ABV, pH, calories, those types of things. Then when COVID hit, we obviously wanted to see, like a lot of beverage manufacturers did, if there was a way that we could kind of repurpose our equipment and our system to make something useful for people. And we were able to. So the two things that we're kind of doing are We have a ton of hand sanitizer that was made. We've since kind of paused production because some of the folks we were making it for, the supplies that they had needed to come in from places abroad finally arrived. But we do have that ability, and we still have a few pallets of products still here in-house. So there's hand sanitizer available both in jugs and we have 8-ounce spray bottles, so 12 packs of 8-ounce bottles. And then the second part to that is our lab. We actually ordered the equipment to do COVID-19 surface testing. So really important call out to make here. It's not an individual or a personal testing option, meaning I couldn't, tell you if someone had COVID, but we can test surfaces, whether it's in a business with high traffic or residential, maybe an apartment building or something like that. We can have someone from our team, or if someone from, the person asking feels comfortable doing the swabbing and kind of doing it aseptically. So obviously it's a clean sample. We do have the equipment in-house to test and confirm or deny if the COVID-19 virus exists on that surface at the time of testing, which is useful because obviously then but more importantly then you can identify, are your cleaning protocols working? Are they not? Do they need to change? And that type of information. So in a nutshell, that's who we are and what we have to offer. And I would love to hear if you guys have any questions. Otherwise, I think Erica from our side of things has been in touch with the mayor's office on kind of some of the jugs that we're donating and some of the discounts that we're making available to people. And we'll have all of our contact information if you guys have any questions after the fact.
Great. Thank you so much, Adam, for that. And if you don't mind, I know Claire and I are going to send out the information to you all so that the folks on this call have the lab's information. But if you'd like to put it into the chat, feel free to do so. I want to move us on with the agenda and continuing on with the state of Minnesota. And I believe, do we have Mary Manning, are you presenting? Okay, I think you're on mute. There you go.
Okay.
Awesome.
Okay, I think I want to do something that does slideshow and doesn't show my notes, right?
Sure, if you go to slideshow and at the top of your screen in the orange section, so go to slideshow. Yep, from the beginning. Perfect.
Right there?
Yep, you can hit that button.
Okay, thank you. Okay. Well, here at the State Health Department, we're doing a lot of things and working with the SEOC. And what I want to cover today is community-based testing and hotspot testing. And that's what I'll be talking about. The goals of our community-based testing is to ensure that populations that we're focusing on have access to COVID testing. We're providing no barriers testing and trying to make it accessible and in partnership with trusted community partners. And no barrier testing means there's no cost to the patient for the testing and no documentation of legal status or anything like that required, just what's needed for a person to be able to get their test results back. Otherwise, we need no other thing except for demographic information to track, who are we reaching and what's the positivity or the negative, if it's positive or negative. But we aren't tracking in order to bill or anything. Okay. And I wanted to go over what populations are we focusing on. We're focusing on populations of color, indigenous populations, LGBTQ, persons with disabilities. That's one area where we're just actually, I think, really getting I actually haven't had as much progress as I think we're just going to be starting with, because that's always, I think, somewhere we're really late to, especially when you get into not only physical disabilities, but other sensory issues and the like, and we're starting to make some headways there. We're also looking to help assist people with higher risk factors for COVID. Those risk factors could be advanced age, other underlying health conditions. I didn't mention that in my non-COVID days, I'm the director of the Health Promotion and Chronic Disease Division, so I care a lot about cancer, diabetes, hypertension, arthritis, and all those good chronic conditions that none of us want to get, stroke and the like. We also are looking at people who don't have health care, who have experienced historical trauma, are socially and economically disadvantaged, who have experienced or are continuing to experience systematic and individual racism, discrimination, and stigma, and have transportation barriers. So these are the types of things we are trying to address with and addressing all the things, the risk factors that I just mentioned to you. We're trying to get information out to people, showing them what it's like to be swabbed, trying to get people information about, well, if you're positive, hopefully maybe we can help with finding resources for you to be isolated, because maybe you're in a home where there's a number of people, and what do you do about that? People don't want to lose. People are concerned about, reporting positivity rates and different rates going up in areas where schools are dependent on whether or not what the positivity rate is. So there's a lot of different things that we're trying to deal with. Trust, the time of the appointment, and we're partnering with communities to make sure that in a lot of cases we're partnering with folks like Open Cities and other community-based organizations, so people are familiar with the people that they interact with when they come to be tested. The state-sponsored community testing is free. That's one type of testing we have. No identification is required. We request a phone number or an email so that we can report the results. Pre-registration is not required but encouraged, because we do really want to have some idea of what supplies that we're going to need and can plan somewhat. But there have been very few locations where we've gone beyond our capacity in those state-sponsored free events. Then we're also working with trusted faith organizations, like I said, churches, mosques, community-based organizations like Open Cities, but others like West Side, and we've gone into parks and high rises and partnered with a number of different places. I'll go to my next slide. Sorry. Okay. We are also still in the process of working through developing contracts with community-based organizations that will be able to provide more of those accommodations that I was talking about. When you do get a positive test, there are more agencies in the community who are going to start receiving resources, so that there are specific resources that are culturally specific and meet the needs of community members when they do have a positive read. So those dollars are going out right now. They're supposed to be out here in October, and they go through the end of December, and we're looking for other resources to continue those grants. But there are about 80 different ethnic, media, and community-based organizations that are going to be working to communicate important information and also deliver essential services like safe housing and other things like help with people who are in food insecurity status or other things. Okay. And there's, I don't know, I think you'll be able to access some of these resources here. I don't know if you'll be able to put these websites up, but these are sites where you can find out where community testing locations are. And then there's a video that we have that shows you what to expect when you go to a testing. And they're done in different languages, which I think is very helpful. I think the picture is really good, but it's also good to have the different languages. And basically that I'm just trying to be brief, and that's what I had to cover today. Oh, and if you did want to request, let's see, a testing event, we do have folks that you can request a testing event through, and what you need to do is to contact myself or someone at Ramsey County, and we will, like Mark Jackson, who I believe is on this call, and we will try to see if we can arrange to have a community's needs met if you aren't finding what you need on one of those websites. But we have, in Ramsey County, there's quite a few surge events planned, and then we keep evaluating the data of the community to see where we should have future events. And that's the end of my presentation. Okay, I can't tell, did I stop sharing?
Yes, it did.
Okay.
Great. I know I always have to check myself because I'll start looking at emails and probably like quasi-confidential stuff while I'm still sharing my screen. So it's always good to check in on that one. So next up, well, a couple of things. You can see Adam put his email address in the chat as we're monitoring that. And so if you want to reach out to him directly, please feel free to do so. We think that this is a wonderful opportunity. Now moving on to, I'd like to have Ramsey County Department of Public Health, a representative from there, to speak.
Hi there, we drew straws. I won.
You won, Lynn.
This is Dr. Ogawa, Lynn Ogawa from Ramsey County Public Health. And actually, I don't have any slides because I'm not adept enough at sharing my screen or doing those other things. Plus, was just going to talk briefly about what we're currently doing within Ramsey County. Others have already sort of alluded to the fact that we're also supporting a number of essentially lots of different groups of folks. The community, in terms of Minnesota Community Care and Open Cities and the federally qualified health centers, we're supporting in certain ways. The state, we're supporting in other ways with their community testing sites as well. And then independent of those, we've been providing since, well, for 2 months now, mass community testing sites, specifically at Aldrich Arena, and then we had also done some at Washington Tech. We did those sites in conjunction with community organizations like the Karen Organization of Minnesota, HAP, and we are continuing to work with communities within the Latinx community as well, like Clues, and with the Mexican consulate, specifically to communities that are needing testing like that. We've done I just looked at the numbers supported by Mark, probably more than 10,000, closer to 11,000 tests in the community. We're running about an overall 5% positivity. As a public health provider, I talk a lot lately about how I'm actually more interested in negative tests now than I am in positive tests. The way that we're testing, we want to be aware that, yeah, we want to go where the people are positive, but we really want to be keeping people safe still. So that 5% positivity rate is really important because that is closer to the CDC recommendations of that showing controlled, essentially controlled transmission. So anyway, and I really was going to talk for a very short time like that. I was going to lean on Laura Anderson to also somehow share her screen and show the website on Ramsey County's site that shows all of our the information for our testing at Aldrich community. I did also want to mention we've been testing within the homeless community over the past 2 weeks, and supporting the mass testing at St. Paul Opportunity Center. We've done over close to 400 tests there, also running at a low positivity rate, which is both reassuring, but it's a community that we recognize is at high risk for rapid spread. And so we feel it's important to be there and be present. So Laura is scrolling to the right place.
Good. Yeah, I think it's important to remember that the sites that we've identified are located in areas where we know we have higher positivity rate, and that's been a strong proponent of this response for us, is going to where the need is.
Yeah, sorry, and I forgot one other thing, and that is that along with our community partners, we are making sure that we have the ability to expand as needed for community partners who sort of identify pockets of individuals who haven't been able to get into regular testing, and so we can sort of when community groups come to us saying we especially have a need, if we can't get to them, we can at least get them to testing often. And if anybody else from Ramsey County wants to throw anything else in there, they certainly can.
Okay, great. Thank you so much, Ramsey County, for your presentation. I wasn't sure, Laura, are you presenting as well, providing any additional information?
Nope, I think Lynn has covered it. Thank you, guys.
Okay, great. Okay, great. So let's move to the Medicare, Minnesota Medicare.
Well, hello, everyone, and thank you. This is Helene Frent with Minnesota Community Care, and we are pleased to be able to join you in this presentation environment today. Let's see if I can share my screen. Oh my goodness, there we are. Start at the top. Thank you, Open Cities. That was a wonderful presentation with lots of wonderful data about the state. And I did not include the state, so that was a great introduction. Minnesota Community Care is a federally qualified health center. The mission is strengthening the well-being of our community through healthcare for all. And that is who we are and what we do. We've been providing care to this community since 1969. We started as a grassroots healthcare center, became Westside Community Health Services, and in January of 2019 branded our name as Minnesota Community Care. I'm going ahead of myself here. We have a board of directors, and 50% of them are patients, and they represent the community that we serve. Many of our staff are also bilingual, bicultural in Hmong and Hispanic backgrounds. We also have Karen speaking and Oromo and other languages as well. We have multiple sites around the city. There's the West Side Clinic and East Side clinics. Both have dental nearby or inside them. We also have a clinic at the McDonough Homes public housing environment, clinics in the 9 St. Paul high schools, and the Healthcare for the Homeless program is located at the downtown clinic, which is right there at the St. Paul Opportunity Center, and at the Union Gospel Mission. And we also have providers who go out 4 mornings a week and meet with people who are staying outside unsheltered. Within the organization, we are well connected to community groups. We have WIC coming in, we have Legal Clinic, we have a community-based research group that involves community members, and it's called Salamo, which is for Somali, Latino, and Hmong. We've had a breast cancer survivor group for patients, particularly Latino women, for over 15 years. We do partnering events with many members of the community, including CLUA's, the West Side Community Organization, Neighborhood House, St. Paul Public Housing, and many others. We have a community health access team and health educators that are really focused on the community and how to increase health access and outreach to make sure that the communities in St. Paul and around do know that we have healthcare and that they are welcome to join us here. In the last year, we served 38,000 patients. This is a very busy slide, but it includes some of the statistics about the population. Over 50% are Latinx. Many of our patients are uninsured, and we have a discount program, and no one is turned away for inability to pay. And our services are across the lifespan: behavioral health, dental, pharmacy, just a mix of things. And then getting on to COVID. The organization started testing in March. There were 2 testing sites set up right away. One was at the East Side Clinic, and that was a drive-up testing in the parking lot. They had tents and people were outdoors doing tests. And at the downtown clinic, we had a walk-up tent, and we're serving the community where Dr. Ogawa was explaining that she's doing her testing. So we've been out there providing that support for the community since March, and continue to do that. East Side Clinic and the rest of the organization has actually moved their testing indoors. And so people are welcome to call and come in to make sure that they're getting their symptoms evaluated and testing is available. In terms of community testing, Minnesota Community Care specializes in small events of like 25 to maybe 50. We are able to schedule on short notice. We are open to repeat events, and we are eager to join your community events and offer testing as something that maybe would be of appeal to those attending. So far, we've done a few events. We've been at the St. Paul Public Housing McDonough Homes community. St. Paul Public Housing was really eager to make sure that their residents were safe, and they asked if we would come. They felt that maybe some of their residents would be afraid to get tested because it would affect their housing status. And so they notified us of that concern and wanted to make sure we did what we could to reassure people. We went door knocking, brought staff that were bilingual in the correct languages for that community, and had our event. Public Housing supported us with some facility in setting up the time and where to locate. They had facility staff there to support the event. And they also provided some snacks and incentives. They posted flyers, and we did the rest to coordinate our staff and supplies. And Public Housing was really grateful that we were able to be there. The residents were grateful that we were there. And so we had our first good event. And then we went on and did another event at the St. Paul Opportunity Center just this week for a very small group. And we're able to, again, set up quickly, coordinate it with the site staff, figure out who needed to be contributing what piece of that event, and got it done. And it went well as well. So when we are partnering with an organization, we would look to them to help provide electricity and power so that we can plug our computers in outside, and for you to help promote the event and support some pre-registration. To provide some access to a bathroom would be helpful, maybe share Wi-Fi if that's available, and also to help with some incentives like snacks and water. And then a few staff people to help with the greeting, and just helping people remember safe distancing. And then I've included a few photos. Here's at the downtown location. You can see the snow in the background. They were in the cold. And the same at the East Side Clinic. They were also out in the snow this winter, working on the events. Here's a few modeling gowns that were made by one of the midwives' mothers, made us gowns. That was great. And then here we are just located in one of the tents outdoors, and waiting for patients to come. Here's some contact information. Feel free to reach out to me by email. Let me know what we can do to help serve your community. We are ready and available on short notice to meet the needs of your group. Thank you.
Thank you so much, Helene, for that presentation. Again, save your questions for the end. We've carved out a little bit of time. And last but not least is United Family Medicine.
How do I stop? Do I have to stop sharing?
Yes, you do have to stop.
There we go. I think I did.
Yep, you did. Perfect. Do we have someone from United Family Medicine? It doesn't look like it as of yet, but maybe they'll join in. So I want to pass it over to Noel Nix, who is community engagement point person and lead on the racial equity work group, and he'll lead us through the Q&A session here with the remaining folks that we have here on the call. Noel?
Hey, thank you, Tony. So again, my name is Noel Nix. I'm the Deputy Director of Intergovernmental Relations and Community Engagement in Mayor Carter's office. Really want to thank our testing providers who were able to join us today in sharing the great information about their testing capacity, as well as ways that they can partner with community groups to bring testing into closer proximity with community. So want to open it up to see if there are any questions. I know that we have mostly testing providers on this call, but want to see if the providers have questions for each other or clarifications, or if we do have one or two community representatives on the call, if there's questions as well. Otherwise, we'll be sending this out as a recording, so that those who weren't able to make it today can observe the presentations, and we'll certainly forward questions that come in. But any questions? Sounds like there are not going to be any questions. So, Tony, I'll turn it back to you to talk about potential funding opportunities around testing partnerships.
Well, great. So yeah, we didn't see any questions in the chat, and I'm just kind of monitoring who's all on the call. So I think this will be a repeat for most of the people who are on the call here, that we have a funding opportunity with Blue Cross Blue Shield. Their representative Lucas had to jump off, had another meeting, but they have provided some information over to us, and I think we've sent it out to most of the folks here at the, on this call. But basically, an opportunity to utilize. They have, I believe it's up to around $5 million, if I'm not mistaken, that they have to use between now and the end of the year to contract and work with community organizations on testing, specifically, and other COVID-19 related work. And so we can send out the form to this group, especially the community organizations. Again, it's about putting money into the hands of community, and we want to make sure that we talk about those opportunities and help broker them and partner with you all on that. So if there's any interest, please feel free to reach out to us directly. For the providers on the phone in the county and the state, you already know about this opportunity because we talked about it earlier this week. But for the community organizations that are on, feel free to take advantage of this opportunity. It's rare when money's on the table, so don't let it go until we have until now, until the end of the year, to do that. And I think we have covered our agenda for today. Are there any thoughts, questions, additional insight that we want to discuss before we end the call?
This is Helene. I wonder, I had come late to the meeting when Amy Bloomquist joined this week, and I do have the material you sent with the spreadsheet. Was there any written material about kind of defining what they're wanting to fund, some parameters around that? I don't seem to have that material. I don't know if you could send that to me.
Did you get the document that was like a blue form that had different questions for you to complete? Was that
yes? Yeah, it asked for stakeholders and
yes,
such.
Yes, that is all that they have given us, to my knowledge.
Okay.
Claire, do you have any additional insight? And Claire may be trying to get herself off of mute on this. Helene, we'll look, but that's the only thing that I know that we have. I will say that it's pretty broad. I mean, obviously it has to be related to COVID, right, and testing. So it's one of those things where it's just fill it in, fill out the document and complete it. No.
And I think the other restriction, or the only restriction that was mentioned, is to not submit a grant request if you're a testing provider for services that you would be billing back to Blue Cross Blue Shield. So this should be for activities and COVID-19 related services that would not be billed to insurance.
Yes, great. Thank you for that, Noel.
But to any insurance or specifically just Blue Cross?
To them.
Okay.
Yeah. So no double dipping.
Yes.
That, and basically what that means. So I mean, it's very limited in their restrictions. So I do it. Anytime there's money on the table, I definitely jump on it. I encourage you all to do the same. Blue Cross Blue Shield reached out to us, and so we think it's just a great opportunity in filling a space that the city couldn't do, and a lot of other organizations weren't able to equip to do. So please take advantage of that. Okay, so we are at the 3 o'clock hour. I don't see that we have any questions or additions or comments. I know some folks had to drop off of the call. We appreciate you all joining us, and for the providers and county and state, we'll do this again on Tuesday, some version of this again, and hope to have more people join us during that time. It is a Friday, it's 80 degrees, afternoon. We're competing and get some things. that we can help. But Monday is going to be a little bit, or Tuesday is going to be a little bit cooler, so maybe people will be a better state to join a call. But thank you again, and have a great day, rest of your day and a weekend.
You too. Thank you so much.
Bye-bye.